as far as you're concerned?
The direction's right, the destination's right, the scale, the pace is wrong.
OK. Niall Dickson, what's your view of it?
Well, I agree with a lot of that. I think there is a tendency to confuse two issues. There have long been a history of public opposition to changes in the way that health services are organised. Sometimes those reorganisations were good and sometimes they were less good. But I think we do have to move away from an obsession about bricks and mortar and buildings and more talk about services. The reality, of course, is that services at the moment are under enormous pressure. And part of the reason for that pressure is that services are not properly organised to be able to provide care in the community, which prevents the pressures reappearing in the hospital sector. Mm-hmm. And I think a lot of these plans are an attempt to try and move that on so that new services are developed in the community so that there then becomes less pressure in hospitals. The question, however, is a justified one. We are in a very difficult period, particularly around social care, where funding has in effect been cut, and we've now got 2 million elderly people without any kind of support in the community at all, who should be getting support. And we've also got an NHS which frankly has managed rather well over the last 5 or 6 years with very little extra funding. And I think that is really starting to show now. So there is an absolute funding issue at the heart of this, but the need for reform is absolute. It's not a question of let's have some more money or let's do a bit of reform. The fact is we need both, and simply pouring more money in will not solve all the problems.
I mean, you know, you said about moving away from the obsession with bricks and mortar, but if you hear of local plans will involve closures or downgraded hospital facilities, inevitably you'll be worried about what it will mean for care where you are.
Well, I think that's right. There's always a balance between access and quality. And the question then is, are people simply shutting these things down simply for financial reasons? Or are they shutting them down because they can actually build a better and more viable service? And it's both a question of resources, but it's also a question of manpower, whether you can actually get the specialist skills and spread them out throughout an area, or whether you're much better concentrating them. The reform of, for example, stroke care over the last few years has absolutely demonstrated that you can improve people's chances of living if the ambulance drives past some hospitals or former hospitals or whatever and goes to the specialist centre.
So on that, I mean, just because in London specifically there were 30 areas where you'd get treated for stroke, now it's 8 super centres and the care has improved as a result.
Yeah, correct.
Yeah, OK. And Andrew Goddard, I mean, obviously the ultimate goal, as we're hearing, is about a better and more viable service, but you're talking about your concerns about the time frame and how it's done. If it's done in the way that is being outlined, does it therefore mean that it's actually not a viable proposition?
I don't think it is. So I was on call last night. I was running around our medical assessment unit, seeing patients, trying to find beds for them. We're really under pressure at the moment. The thought of suddenly having 10% less beds, and some of the plans are talking about 25% less beds, just doesn't seem achievable to me in a 3 to 4 year time window. Great, let's try and aim there in 10, 15 years' time. But you've got to have the setting, and as Neil said, the setting in the community and the support services there to look after those patients. You can't suddenly move everything. And getting the workforce engaged, as Neil talked about, is really key. The workforce, health, social care, nurses, doctors, if they're not engaged with this, are not on board, it won't succeed.
And Neil, do you agree with that analysis about what the time frame should be?
Yes, I do. I think we've got I suppose the plea to government and some of the national bodies is please have a bit of patience around this. I think they deserve credit for kicking this process off. But of course, everybody wants everything done very quickly, and I absolutely agree with that. The plans have to command a degree of local consensus. And actually, what is being attempted is bringing together organisations that, frankly, in the past have not talked to each other enough and have not recognised their different roles. And often there is waste in the system because it's not properly integrated. But I think, as Andrew says, it will take time to get that, and it does need a bit of patience.
Neil and Andrew, thank you both very much. And if you've got thoughts on this, you can send questions in and we will put them to Chris Ham, who is from the King's Fund, which is voicing